Hello, it's Nancy today. Well, I've had hip surgery. It's been kind of a interesting ride. They took me out of surgery, and it was really interesting yesterday to meet the people at the operating room. They had given me a spinal block. No, they gave it to me in the operating room. That's right. But it was interesting to look around and see how the whole room was sort of prepared. All around the room on the edges were trays with things wrapped up in blue cloths, taped, closed, getting ready to be used for surgery. And then they gave me a thing. Oh, and he had my x-rays up on the side in the surgery room. And he showed me the measurements. He had all these measurements, and he said that there's many different sizes of hips for every size of people, and the joints being what they are. And he showed me my x-ray of my hip joint, and that because of the loss of so much cartilage, whatever amount it is, reminds me of brake pads, So when he puts a new hip in, it'll be the length of the leg plus the cartilage. So it's going to be longer than the other one for a while. Anyway, so I bent over and they gave me the the spinal tap, or spinal, it's called a spinal tap, or spinal block, that's what it is. And I did hear a few things when I was in surgery. I heard a grinding sound, probably when he was sawing the leg off the bone. And then I heard a banging, tap, 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 which must have been when he was hammering the new piece into the bone. Wonder how he does that. There's not a lot of room in there once you are working deep in the joint. And he removed the muscles and ligaments from the bone, and then afterwards he sewed them and I wondered how he reattaches them to the bone. He drills a hole through the bone, and then he threads something through and pulls the muscle or ligament right into the bone, and then ties it there so that they won't rip off. That's pretty cool, isn't it? Anyway, so that was in surgery. There was a lot of people in there. He had a meeting first. He said, okay, everybody, let's have our whatever meeting, and they all talked about, or he told what they were going to need, what they were going to do, and then the people, there were a whole bunch of people in the room at their various stations, and they came back with what they were going to do. We've got this. So I guess he must have washed my whole leg with some sort of antibacterial, because it's all red now. Looks kind of strange to have a red leg. Anyway, so that's what actually happened in the surgical room, operating room. See you later. You can do this at home. Results may differ.